Awareness is a powerful tool for healing. Everything bursting with hope, coming alive. This moment, you gotta breathe out. Why this matters now? Because you matter. Today I want to talk about something that's hidden in plain sight. Across our communities, we are seeing more dysregulation, more escalation, more chronic illness, more individuals overwhelmed, and more children and families carrying burdens that are too often just misunderstood. And the question is not only what is wrong, the deeper question is what happened? So too often it's the act, it's the behavior, and not condoning bad or aggressive behavior. But I can't help but think the worse the act, what happened to them? What was their environment? Our environment is people, places, and things. What was theirs to cause that reaction? What is happening inside the body biologically? Y'all have heard me say it, not what's happening to us, but what's happening biologically when things happen or don't happen. And attachment, engagement, and active play are necessary for children to thrive. For many years, I worked with children and families in health and nutrition sciences. Working with Head Start. And often, I felt there was something missing in how we were understanding illness, struggles, and behavior. And then later, after my own diagnosis, which included a diagnosis of multiple sclerosis, paralysis, and severe food intolerances, I was determined to reconnect and disconnect, rewire my brain. Quitting wasn't an option, but getting to the root was. My immune, or my support, as I like to call it, system designed to protect, not destroy, is attacking me. Didn't make sense. But getting to the root was. Getting to the root is where the healing began. So in 2019, when I was, introduced to the research findings of the Adverse Childhood Study, ACEs, I never even heard the word ACEs. And again, I was in the arena working with children and families. And I'm thankful for how I heard about this through the work of Dr. Nadine Burke-Harris, through a friend who told me about her book, The Deepest Well, and encouraged me, you've got to read it. And then I listened to her TEDx talk, which was like a magnet to metal puzzle pieces, answering so many questions. So just awareness is a powerful tool. The original ACE study was conducted in 1995 by the CDC and Kaiser Permanente. It surveyed more than 17,000 adults about 10 categories of childhood adversity, including abuse, neglect, and household dysfunction. It found that ACEs were not rare or isolated. They were common, widespread, and strongly linked to later health outcomes. So things like they included physical, emotional, and sexual abuse, physical, emotional neglect, or growing up in a household where a parent was substance dependent, mentally ill, incarcerated, where there was parental separation or divorce or domestic violence. For every yes, you get 1 point on your ACE score. Now, unfortunately, back in 2019, this was not new information then. So when I began to truly take a deep dive, because I had been searching for, there was some disconnect, something, truly understanding the science behind these studies, these findings, it changed my whole trajectory. Why I didn't pursue medicine, and I just believe that conventional medicine today, and it will not just today, it's too sick focused. And I desire to focus on prevention, health promotion, disease prevention. I love science and research, how the body was created, how our mind, brain, and body work as one unit. So the ACE study and later data from the CDC and others, this is not new information, made something painfully clear. Childhood adversity is common, and it has lasting effects on health across the lifespan. Toxic stress can affect brain development, the very brain architect. It can change stress hormones regulation, immune function, inflammation, the kind we don't want, learning. We're talking about the literacy problem. That's the symptom. That's not the root. I think back of conditions like dyslexia. The children that, and mostly children that at the root was that condition, were treated so often as dumb, or they can't learn, or stigmatized, especially if it was a child of color. But when the diagnosis, yes, they can learn, but they could always learn. Behavior issues, not not bad, but abandon, rejection, isolation, conflicts, scared, like a fish out of water. Some scared out of their mind at times because of what they have experienced and adversity. And we too often just medicate, suppress the symptoms. I am not against medication in the short, acute crisis. That is not what is happening. And then there's just the long-term disease risk. This was from 2017. This data. If you had a score of 4 or more risk of ACEs, your risk for heart disease is doubled. Was doubled. And 2.5 times for chronic obstructive pulmonary disease. If you had 4 or more ACEs, 4 times likely for diabetes, 1.6 times Alzheimer's, 4.2 times. And cancer doubled the risk. Suicide, unfortunately, in the United States, the 10th leading cause of death. Now, this was back in 2017. score of 4 or more is associated with 12 times the risk of suicide. Hmm. Illness is expensive and global. And some of these statistics, this data is heartbreaking. This dose response relationship that these findings showed, the higher your ACE score, the more likely you are to be at risk of various chronic illness and behaviors, or to do like smoke, or become an alcoholic, or to engage in early sexual behavior. But this is not just about behavior. This is not just about mental health. This is about health, period. And so there's so much talk about mental health, mental health. And as I've said it countless times, if someone's having a mental health crisis, oh my goodness, rest assured, they're having multiple physical challenges at the same time. But, I'm your wellness advocate, and there is good news. There is hope. That the research shows, and it shows such a clear path and, solutions and directions. And one in particular, that supportive relationships. Just one supportive adult in a child's life. Just think if multiple family members, teachers, and coaches, and communities as ladders helping, individuals or children climb to their full potential. So again, like the research shows that just the benefit of a supportive adult caring relationship. Early awareness. Awareness is a powerful tool in the beginning of change. So routine screening to track. And there are these are in place for pediatricians and doctor's office to make it easy and simply. Because I think about conditions like asthma. Oh my goodness. One of the key symptoms of a child that has been enduring prolonged adverse childhood experiences. Now, bearing that they've been exposed to some type of chemical reaction that is affecting their bronchioles, if in the absence of anything of that nature, and they're on the flip side, a witness list of home dysfunction or just adversity in that child's life, we can track that. We know what that asthma is rooted to. And practical regulation tools. Stuff in place to calm the chaos within can make profound differences. Stress is a natural part of healthy development. But, quoted by pioneers like of the science, like Dr. Jack Strawkoff and the late Dr. Robert Block, this is not what we're talking about. Toxic stress refers to the long-term changes in our brain, in our organs, systems as they were result of high doses of adversity. that prolonged difficulty and misfortune. Children being yelled at and belittled and just exposed to just all types of frightening behavior. And just not feeling safe. All these high doses of adversity that are not buffered by a stable caregiver. Stress, bad things, difficulties happen in this world. We will have trouble. But science is showing us that we as humans have the profound ability to be a biological buffer to each other's stress response. We are better together. We are made for relationship, community, and need love. And as, oh my goodness, one of our beloved giants in this world says it so well, Dr. John Perkins, that, and shows it so. Love is the final fight. We are made for community, relationships. No lone rangers. We are not powerless. This understanding is one of the reasons why I found it. Grace to Overcome was founded on the core belief that adverse childhood experiences have lasting negative effects on health, well-being, and opportunity. So this is why I'm continuing this work through my wellness ecosystem with Grace to Overcome, the nonprofit piece, Restoring You Matters Holistic Health with professional wellness services, and Be Well Ministries, a faith-based arm. And why? I'm having these conversations, this type of conversations on the Root podcast, because I believe awareness is a powerful tool and the beginning of change. We need to talk more openly about toxic stress, childhood adversity, and the science behind what so many people are silently carrying. And healing must include practical pathways. We need to take care of ourselves. This is also why I teach. Education, knowledge is power. So these 6, foundation pieces, they just kind of came to mind. When I was just looking at this global health crisis. I thought, these are these 6 daily acts. I call them my daily, my 6 foundations for wellness. So we eat, we hydrate, we breathe, we move, we rest, we feel. These are not small things. We do them every day. Sometimes several times a day, unconsciously. They are daily acts of regulation, restoration, and medicine when done with awareness and intention. The latter, how we feel, is intertwined and affects all the others for good and bad. Illness begins in the mind. The psyche, our thoughts, our emotions, and our perception, our belief, how we are perceiving this threat, this act towards us. Our vulnerabilities. Children are very vulnerable. They're like sponges. They absorb. And if it's something aggressive and fearful and threatening, they absorb it more. And that is why, as I was sharing earlier, that adverse toxic stress rooted in adverse childhood experience can affect brain development, learning. The stress hormones are just activated and continuing to run. But think that even as adults, think about it. If you're upset, sometimes upset it affects how we might eat or drink. Something maybe too much, or not enough, or not at all, or just our choices, because we just want that comfort food. It's in the name. Or if we're scared or worried, it affects our breath, and we're not knowledgeable that we are regulating, or that we need to self-regulate. And for children, that is harder to do, to self-regulate, which is why the research shows so clearly that the benefit of the safe, stable, nurturing care of an adult. So our mind, brain, and the correlating organs working as units, that we can't separate the mind from the body. So this episode is more than a conversation. It's a call to awareness, a call to action, and a call to hope. Because the truth is, we are not broken. Our children are beautifully and wonderfully created and can recover. I think back of, some of the children that I've had the privilege of being a rainbow in their cloud and seeing the results. There's just too much ADHD and ADD, and a lot of it's misdiagnosis. Too much writing that quick prescription to suppress the symptoms. And not against medicine in acute crisis, but that's not what's happening. We are biological, and we are hardwired to heal. One would think that we are a broken people, but we're not. We are hardwired to heal. We can repair, but we can't repair if we're not aware, or not following the science and the signs. Behaviors, they're symptoms. They're not mistakes. Symptoms, they're messages. If we listen to what they are saying about that person holistically. This is all of us. We all have an ACE number. Or what is yours? Is 0 to 10? The word is used often, triggered. So if If this message resonated with you personally, I'm sending you a hug. I see you. I see in you value. You are an overcomer. And if it doesn't, I do ask, share it with someone who needs hope today and who needs some awareness of what there might be a train wreck in relationships in their life, and they're the common denominator. It's not what's happening to us. What's happening biologically when things happen or happen or don't happen. And I often think of behaviors we talk about. Oh, beware of narcissists. People with narcissistic tendencies are narcissists. They're not created. I mean, they're not born that way. That they're created. I mean, I think about the abandonment, rejection, the isolation, what those individuals didn't get, to be able to have to create their own world where it's only about them and nobody else, to their own detriment. And granted, yeah, the being a part of the brunt of that behavior, oh, whew, but I still wish those individuals well, health, awareness. You know, Healing begins when we understand the root. So this is a call to action. When the late Dr. Robert Bloch, the former president of the American Academy of Pediatrics, said adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today, he was not exaggerating. We are in a global health crisis. We're talking about a 20-year difference in life expectancy potential. I mean, the data is clear. The findings aren't, well, they're definitely not new. This data from almost 30 years ago, hundreds of thousands have heard ones like Dr. Jack Galko and the late Bob Bloch and Dr. Nadine Burke Harris and others. But these three have been on the forefront, have defined and explained the lasting negative effects of adversity. Because that study that was done by the Pfizer in Kaiser and the CDC was done on adults. There's been other studies done. I know from Dr. Burke Harris where similar, but the mean age were children, like 8, that were still accumulating the potential to accumulate ACEs, more ACEs. So their efforts have been with urgency and clear to spread the word. I said that Dr. Nadine, I heard of Dr. Nadine Burke Harris initially when a friend of mine told me about her book and then her TEDx talk, which when I heard the talk, she's in the red dress, it was like I was like a dog with a bone. I'm like, what? Sharing, telling. But since there's been so many other talks that she's had and others with urgency shared around the world and recorded videos that hundreds of thousands have watched. And I don't know, I guess, are they watching them like a show? I don't know. Again, I was in the arena for decades, but I was unaware. So I'm still trying to struggle on the disconnect and how can such a vast number of uh, professionals, health professionals, uh, policymakers, pediatricians hear this groundbreaking science and the severe effects in solutions too for close to 30 years, and it still remains under addressed. You know, some partly ignored, and I don't know if it's the stigma of a mental health issue or it's that zip code or is this that population of people. This is all of us, and I think wow, it was back in 2017. Just wanted to kind of show some of the gravity here. About 4% of pediatricians were screened. Now we're in 2026. It's about 11 to 15%. Why? It, I can't help but think about COVID. No doubt, a public health crisis. Now it took, and I'm going to be kind of generous. It probably was a lot less than this, but about 6 months to a year for major widespread policy actions to be put into place in the United States with significant sweeping measures, shelter in place, curfews, wear the mask, social distancing, and all those necessary things while they were troubleshooting this so-called virus that had invaded the world. Still, in 2026, the whole world knows about COVID. Populations with some populations of people were suffering a lot more, younger and ones with underlying conditions. If we look holistically at some of those underlying conditions, we probably would find toxic stress. I will not let the words of the late Dr. Robert Block uh, statement, die. Adverse childhood experience are the single greatest unaddressed public health threat facing our nation today. This science is clear, and the findings impeccably easy to verify and track. So that is still so disturbing. I mean, at my root, I'm a holistic health facilitator, providing steps to a healthier us. So I'm always looking on the preventive end of things, or the how can this be improved? How can, and I at my core vested in our youth being strong, vibrant, and equipped. Now, as youth over the lifespan. So we are in a global health crisis rooted in toxic stress. What are we going to do? I ask you to partner. Partner with me, partner with us, join the movement that is not new. I'm so thankful. I tell you, I got to meet her briefly at a conference a couple years ago. So thankful for the pioneering work she continues. Dr. Nadine Burke Harris, leading the trail. We need collaboration with a common goal. When I becomes we, even illness becomes wellness. If you're spreading the word, up your message. Let's have a conversation together. There is a part for all of us to be doing. Physicians, especially pediatricians, law enforcement, social workers, child getting tongue tied, child advocacy, parents. It starts with us, with you, your community. People, toxic stress is not just stress. It is prolonged, unbuffered biological wear and tear. And we can no longer afford to treat it as invisible. There's dysregulation plus dysregulation equals escalation leading to chaos rooted in toxic stress. And we have dysregulated from providers to patients, to law enforcement, to people doing criminal behavior. And it goes on and on. Hardwired to Heal is a public awareness initiative. It's a community initiative focused on understanding toxic stress, the biological impact of adverse childhood experiences, ACEs, and building resilience for healing and prevention. Join us in raising awareness and supporting healthier futures for children, families, and communities. And this is paired with the trademark framework FAME Foundation's curriculum. The 6 daily practice supports regulation of the stress response, reduces inflammation, and strengthens resilience. If you're interested in collaboration, volunteering, partnering, learning more about this initiative, or you would want me to come do a formal presentation of this topic to share more in depth of what this science has shown, but also the solutions, I'd love to connect. We are stronger together. When I becomes we, illness becomes wellness. It bears repeating. And thank you for listening and acting. And again, desire to use this platform, this podcast, to be part of a conduit to spreading the word. So in ways that, as I said, we can all do our part. One way, through subscribing, liking, and sharing this channel, is a way that you all can do your part. So, till next time, on the road to recovery, at the root, because you matter. This is Pamela Hawkins, your wellness advocate. Be well.
You believe the change is coming. change is